Well, back and leg pain affect millions of Americans every day, but there's a simple treatment option.
That's right. Sylvia Cosmieta wanted to learn more, so she sat down with author Dr. Wendy Toohey of the Dr. Gil Center for back, neck, and chronic pain relief. Take a look.
Back and leg pain can not only be a chronic condition, but it can also cause debilitating pain that can cause folks to suffer not only for years, but also suffer from lost work time. That's why I'm so happy to have with us Dr. Wendy Toohey, who is a chiropractor with the Dr. Gil Center for Back, Neck, and Chronic Pain Relief. And folks, she is also an author. She has written The Road to Relief, and I'm so happy to have you here to talk to us about this chronic condition. I'm sure a lot of people suffer from this.
Absolutely. Thank you for having me.
So talk to me about what causes chronic back and leg pain.
So it can begin as just regular wear and tear, but often what we'll see is just a bone out of place that puts pressure on a nerve, and those nerves from the low back go all the way down to the tips of the toes. So it can cause that sciatic pain that people have. Over time, what happens is the disc itself, the cushion between the bones, can degenerate or break down, and then the hole that the nerve comes out gets smaller. And the disc material itself can also bulge backward, and that can be really excruciating when that puts pressure on either the cord or the nerve. It can send symptoms into the back or into the buttock or down a leg on either side. And ultimately, it can create things like neuropathy and things like that. So it can be really excruciating and really debilitating and affect a person just being able to live their life and do the things that they want to do.
That has to be frustrating to see patients come in like this. So talk to us about the treatment options that you offer. And I hear that these are treatments that do not involve pills or injections or even surgery, right?
Absolutely. We successfully treat thousands of patients without medications and surgery. And I've had a disc problem myself that radiated down my arm, so I've really created care plans and treatments that I know will be effective for these problems. So non-surgical spinal decompression is the core of our solution, but many of our patients will need other therapies along with that. So we have terrific things like red light therapy, which increase blood flow to the distal part of the nerves. We've got a neuroanalgesic machine, which if someone is in really excruciating pain, it can help to just blunt that pain and make it bearable while we're handling the cause of the problem, which is that they have a nerve impingement or a degenerative disc.
Dr. Toohey, what about the book? Is this something you give to patients to help them better understand treatment options?
Absolutely. So we have so many options available to our patients. I just wanted them to have a basic understanding of how those things work. I love for people to know what's going on with them and how each tool that we have can help better their symptoms. And I feel that comes from a place of understanding. So there's lots of references in there on how these different therapies are effective and a really good explanation for those who want to have a better understanding of those treatments.
So good to know. So doctor, then who do you treat?
Well, we treat people obviously who are in pain and people who symptoms are affecting them in a way that they're not able to do the basic things that they want to do. Unfortunately, by the time people come to see us, I had a woman the other day, she said, "You are my last resort." So it doesn't have to get to that point, but certainly we can still help those patients because of the options that we have. But a lot of the people that we treat, they've tried other things, they've tried medications, maybe steroid injections, physical therapy, and it just isn't cutting it. And they don't want to be taking prescription medications and they're fearful of surgery. So we have excellent options and solutions for everyone. And we just need to really do a thorough exam, know what's going on, and create a solution that makes sense for getting them back to doing the things that they want to do. Because ultimately, the people who come to see us, they could have been hurting for years. They come to see us because they're not able to live their life the way they want. They're not able to pick up their grandkids. They're not able to do even some of the basic tasks that they want to do. So it's about living their best life, and that's what we love helping people do.
Being that you've been impacted by this type of condition and you see patients walk through your door, how does that touch your heart when you see them leave and they're finally getting the relief they've been wanting for years?
Well, it's humbling. And what I'll tell you is just when I was in pain, it was humbling because it helped me to listen and have a better ear for what's going on with people. And it really helped me understand if somebody's in pain, they can't even have this conversation. they are so stuck in their body, they hear part of what you're saying. So if it gets that bad, they really can't live the life that they want to live. So when we are helping people, I tell our staff in our staff meetings, we are changing lives every day. We take it for granted because it's our expectation, but really these patients are really getting their life back, able to do things that they haven't done in a long time and able to do things that maybe they didn't even know that they could do.
That's a beautiful thing, doctor. So talk to us about a special offer. I know you have one for folks that are viewing who would like to maybe have their condition evaluated.
Absolutely. So for the next 10 callers, we're offering an examination, consultation, x-rays if needed, and a report of findings for only $49.
Well, doctor, thank you so much for educating us about chronic pain, the things that you can have done to treat that. We so appreciate your time today.
Thank you for having me.
I'm going to send it back to you.
Thank you, Sylvia. Be one of the first 10 callers and receive your initial exam, x-rays, and report of findings for only $49. Call 615-551-3897.